Namaste dosto. Today we will see the Indian hospital scut or a hustle, the work that happens in the Indian hospitals, how far that can be really automated, how far it is really helping the doctors, or are there any ways that we can use AI to overcome the scut work in the Indian hospitals. If you enter any Indian hospitals, you see the majority of the work, apart from seeing patients, doing surgery, doing actual patient care, there is a lot of work which is done in the paper, filling the forms, and for example, writing discharge summary, diagnostic reports writing, and getting the diagnostic reports and attaching them to the case paper. And such a work is actually very immense, and this is actually error prone. And with the help of AI, can we really reduce this work and burden less our junior staff, especially if you are in a medical college, the house surgeons. We see the house surgeons, what they do, they basically write the discharge summary, which is basically a re-entry job, data entry job. Should we really make these students to do it manually, or are there any ways with help of AI we can reduce this? In fact, the AI has come as a solution to help this lot of the data entry part to be removed and use our junior staff more productively to learn the subject and to take care of the patients. Let us get deep into it. Now we'll see about automation of discharge summary writing. The discharge summary, which is what is it actually? Discharge summary is more often a data entry job. The most of the bulk of the discharge summary is the lab reports and what are the clinical rounds which have been entered in the case sheet. They are supposed to appear in the major bulk of the discharge summary. With the help of the AI, it is very easy to automate them, and also further adding speech to text upon this. Whatever findings which are not there in the discharge summary, which cannot be, for example, if the discharge summary, what you're going to get, if it doesn't contain some part of it, for example, the history of the patient, it was not there in the HRMS, that can be added as a speech to text. With the help of the speech to text, you feed that much and you let the AI take over the big bulk of it, and it will create a complete discharge summary for you. This can be very easily automated, and this will really become more accurate. In fact, with my own personal experience, the way the discharge summary the AI is generating, its grammar is correct, its English is correct, and it is more, in fact, better than any postgraduate who can write the discharge summary. Of course, the discharge summary which has been created by the AI has to be reviewed by the consultant, and the advice has to be given. In fact, the consultant can further add his opinion, again with the help of speech to text. He will give the speech and it will generate the text, and it will combine with the existing discharge summary, and further the discharge summary can be improved upon. So this is the first automation that can be done with AI and reduce the scut work of the second part, that is radiology reporting with the help of speech to text. See, you know that most of the radiology reports are in the textual form, be it a CT scan report, ultrasound report, or be it even mammography report, whatever, all the radiology related reports, even the endoscopy, or you can include even echocardiography, angiography report, even this can be extended even to the procedures which are done. They are all in the textual form. Now, when the radiology reports are generated, usually what is done these days is that there is a fixed template. The radiologist fills the abnormal findings and generates the radiology report. Now, with the help of the AI, super added upon these templates. Now, for example, you can give a speech to text addition for this. The radiologist will utter only what is abnormal in the given report, and he will load the template and generate with the integration of the AI, the actual final radiology report, which is in fact will get filled with abnormal findings, and in fact the AI will write even the complete impression for it. Upon creation of this such a kind of radiology report, the radiologist will anyway review it. If there are some minor adjustments which are required, he will use it. So the speech to text with respect to the radiology is the biggest boon. With the help of AI, it has reduced the most of the work. In fact, I can give the in more own hospital, our radiologist is using this technique to create the reports now. Lab machine integration with the EMR. You know that the lab machines, today's lab machines like Siemens or Beckman, Roche, and many more which are coming these days, they have got a capacity to integrate with the computer now. Now, this can be further integrated with our HIMS, what I am telling, nice HMS. So, further with this integration, the reports which are generated in this lab, for example, complete blood count, CBC, or biochemistry panel, which has been created with that, the data can be directly pushed into the EMR. And with the help of the AI further, the abnormal values, of course, the normal range, out of range, normal range, given and taking the concern with the clinical picture, AI can be super added upon it, and it can alert the clinician if there is something which is seriously abnormal, and it can call for immediate action. So LIS integration with the EMR, which is very crucial. In fact, it will reduce the errors. We have seen basically the lab report which are being typed, there are a lot of mistakes, especially when putting the point like a dot, for example, 0.0012, the lab type is sometimes put 0 somewhere here and there, and the value really goes off. So this kind of mistakes can be reduced with LIS integrations. So this is one more helpful technique or way to reduce the Scut work in the hospital, and the technicians can focus more on the actual process rather than the typing. So this is a data entry job which can be further reduced with the help of HIMS. So insurance claim in India is still mostly manual, and most of the work is scanning the case sheets, scanning the discharge summary, scanning the bills, and uploading it to the portal of the insurance provider. This kind of approach is very hectic, and it is cumbersome and prone for errors, and many other times there is back and forth sending of the messages, and to get approval of the insurance claim really takes a day, or sometimes even more than a day, and it is really a nightmare for a patient. Most of the patients now, they don't opt cashless because they think that getting the cashless claim will delay their stay in the hospital. Sometimes it may be more than a day. So in reality, this has to be tackled, and insurance claim in India is almost limited only to the inpatients, and OPD insurance claim is a myth because it is being manual, and OPD needs a very fast claim processing, so which cannot be done manually. It has to be driven by the artificial intelligence. So the government of India has launched a National Health Claim Exchange portal. However, still somehow this NHCX is not fully functional. It is slow in its functionality, but with time, I am sure that it will come into full force, and it will be a major milestone in insurance claim processing. So as a nice HMS, we have implemented NHCX, but only thing is, as the claims are not really happening, still it is redundant. But upon NHCX, if you implement artificial intelligence, the processing side, especially on the TPS side, there also the insurance claim process will become more faster, and it will be more efficient. So this is also one area where the artificial intelligence can improve the hospital related work. And you can imagine the OCR, that is optical reading of the data or whatever, even if it is a text return, it can be read with the computer with help of the artificial intelligence and processed. That also can be done. So the AI is going to really help the insurance claim processing upon the National Health Claim Exchange, which is partly functional, I think so. It will become by the next year, end of the next year, or somewhere in the middle, it will be fully functional, and the insurance claim processing will become much more streamlined. AI chatbot and automation of the appointment. Now we know that the maintaining AI chatbot is not a big deal these days. With help of the conversational AI, in fact, the help of voice agents, we can easily generate AI chatbots, both in the textual form and the voice also. The patients can come to your website and ask for an appointment, and in fact, they can communicate with an AI chatbot, maybe in the text form or even with the voice. Voice agents can be activated and implemented, and it can be connected with your database, and it can give appointment to the patient whenever and required. And in fact, smaller issues can also get solved. So this is one of the wonderful technology which is coming up. It is a bit expensive these days, but I'll tell you, within maybe under 6 months or 3 months, the cost of the voice agent is going to come down, and we'll be able to use it more and more efficiently in day-to-day work. Apart from the voice agents, the other ways of getting appointment is using the WhatsApp itself. The WhatsApp can be used to get appointment, especially in our own HIMS. We have implemented the WhatsApp with help of in Nice HMS. The patients can take appointment of the doctor with asking with just click on the button within the WhatsApp. So apart from voice agents to WhatsApp, there are many ways the AI can help us in integration and reducing the most of the manual work. And in fact, this AI chatbots can send alerts to the patients. Like for example, the person if is due for antenatal checkup, or person is due for the immunization day, these things can get automated. And if there is a need for the follow-ups visit, patients can be alerted with help of the AI. AI will read the case sheet, and if it is required, taking into consideration of the appointment and all the possibilities, which can generate and send the message. So this kind of Scut work can be implemented easily with AI, and it should help the patients with many ways. Of course, we have already seen in few of the developed world, they do have an AI chatbot almost implemented in almost big hospitals. The patients do put questions there, and the AI will generate the answer. And of course, before sending it to the patient, one of the consultant will just has to see whether what it has generated the answer is right or wrong. For example, there are usually small doubts like, sure, I have some minor headache getting, or some side reaction, patient is suspecting side effect of the drug or something like that. Some small issues which can be solved with a telephone call. The patients can now use the help of AI, and it can be solved. Apart from these, what all we have seen now, there is AI can further help us in improving the actual operational workflow. So AI can predict the rush hours in the hospital. It can predict which consultant may get more patients. In real time, it can predict it and transfer the your workforce towards that, and manage the hospital, especially the big hospital, more efficiently. So you can predict that, for example, on this day, this doctor will get more patients or something like that. Checking the appointments, which are given, which are really coming patients, what are the OPD load, OT load, all these things can be predicted very efficiently with the AI. So this is also one of the important area where AI can be implemented. Of course, along with all these efficiencies, there are some challenges associated with AI. We should know that the artificial intelligence is not a deterministic science. It is probabilistic science. So there is an issue of accuracy. Of course, since from the launch of the ChatGPT in 2023, we are seeing the AI has been improving very fast, and the accuracy and the efficiency with which it is predicting, it is near human-like. Still, there are issues, but I personally feel that this will definitely overcome. Just for example, I want to compare with this with auto-driven cars. So now we are seeing in the West where the auto-driven or automatically what you say AI-driven cars. What are they? There the accidents rates have come down drastically. Unlike in India, of course, we have some other issues for which the autonomous cars are not allowed here. But that is partly, I feel, it is because of the employment issue. But the AI, rather than thinking of it is a less accurate, it is appearing, it is in fact performing near or even sometimes better than human in reduction of the errors. Of course, even in medical history or in the medical science and hospitals, the errors do happen. If you can use AI along with your doctor intelligence, the accuracy or the errors happening in the medical field or on the patients, the morbidity and to a certain extent the mortality of the patients it will come down. Of course, there are ethical issues. Of course, there are some compliance issues which need to be taken care. Of course, there are legal issues which are totally different. But AI will definitely help this to be reduced, and there will be a better integration of AI in the hospitals. Now, let us. I want to know your opinion. Do you think the AI will help the doctors, or do you think the AI is going to be more useful, or are there any areas where the AI can get implemented so that it will become helpful to the doctors and the patients and even the nurses across the medical fraternity? I want to know your comments. Please do subscribe to our channel, and that's all for today. And Dr. Umesh Bidgi signing off.